Hey everyone, my name is Ben Gibson and I'm a physical therapist at Joint Ventures Physical Therapy and Fitness in the greater Boston area. If you're like most people, over the years you've probably had your fair share of bumps, bruises, and injuries, most of which have gotten better on their own. But every now and then you'll find that you have an injury that either takes a lot longer to heal than you'd expect, or worse yet, you find that it only gets easier to re-injure that body part as time passes. If you've ever wondered why this is the case, how physical therapists can help with healing, and how exercise can be used to both promote healing and reduce injury risk, then this video series is for you. In this first video, I'll be taking you through the basics of healing and how physical therapists help your body to heal more completely than with rest alone. So then, why is it that some injuries seem to heal on their own just fine, whereas other injuries don't? One way that you can think about this to understand it better is to think about it in a similar way to what happens when you have a cut on your skin. If you have a cut on your skin and you take good care of it, you protect it with a Band-Aid, you use antibiotic cream, you're going to find that that cut will heal over time just as you would expect. However, if instead of that there is something that is actively constantly rubbing and putting some friction on that cut, it would certainly delay the time it would take for that cut to heal and might completely stop it from healing fully altogether. So when you have a bodily injury, what part of the process of recovery is correctly identifying the things in your daily life, some of your habits, your posture, activities that you're doing that may be acting like the extra friction on that cut, and that's keeping it from healing properly. The other part of the equation though then is okay, what is going to act like the Band-Aid? What is going to act like the antibiotic cream that is going to actively speed up the process of healing? And the key thing to understand there is that healing occurs through blood flow. All of the body's nutrients that are delivered to help the body rebuild itself and to repair itself after damage is delivered to the area through blood flow. Also too, you have things like your white blood cells that also are there to help kind of clean up debris. All of that waste products that are produced in the process of an injury will get cleared out more effectively when you have better blood flow to an area. So the idea then, right, of the full picture is identifying those things that are delaying the healing process that should normally be taking place, and then if there is some way to help drive extra blood flow to the injured area, then doing those activities will help to improve and speed up the healing process. Now it kind of comes to what is the role of physical therapy in this healing process. So certainly the identification of those issues that are causing the extra friction and rubbing on the cut in that analogy is part of it. The physical therapist will be able to kind of analyze the way that you move, the tendencies that you have that may be contributing to the prolonged status of your pain, the perpetuation of your pain, and then also then be able to help to provide strategies to help improve blood flow to the injured area. Part of this is going to be coming through exercise. If any of your injury is coming from muscle pain, then exercise is going to be a significant portion of getting that muscle injury to heal more completely. The way that you can most effectively direct blood flow to a muscle is to make it do some work. If a muscle does a little bit of exercise, it burns oxygen, and your body's delivery system of oxygen to that muscle to replace it is going to come through your blood flow. So if you can design an exercise that will effectively target the injured tissue, and you can perform it well without compensating, then that is directly going to force extra blood flow to the area where you want it, the most accurately, the most directly. So the use of exercise then will be helpful in producing a greater healing effect and a greater rate of healing right where you need it. The other thing to consider with that though is that, at times you may find that exercise feels that it worsens your pain, right? So that will then come down to what the level of tolerance that tissue has to activity. So the physical therapist's job is to help you to identify a level of exercise that effectively uses the part of your body that has been injured, but at a level that is low enough in intensity that the tissue can tolerate it, that you can generate more blood flow to help speed up healing, but that it's not so overloading to that tissue that it actually further perpetuates inflammation and irritation. So then, the other role for physical therapy, one of the other roles for physical therapy will come down to the manual treatments that we can provide. In part, the goal there is to help direct blood flow to the area. Areas of extra stiffness or tightness or soft tissue restriction can inhibit the body's ability to provide adequate circulation to the area. So there are various different treatments that can be provided by a physical therapist in order to help address these areas of tightness and restriction in order to help improve blood flow, improve circulation, and then therefore speed up healing times. So now you have a better understanding about the variables that affect both the quality and the rate of the healing process, and also the role that physical therapists can have in that process. So if you happen to have any nagging injuries that just don't seem to be getting better on their own, then visit us online at jointventurespt.com, call one of our offices, and set up an appointment. If you found this video helpful, then definitely follow along for more videos, as we have a number of them planned. But if there's anything else, any other topics that you would like to see me cover, definitely drop a comment and we'll do our best to meet those requests. Thanks so much.